Of course, it's Thursday, and we are always here for you. As far as you and health is concerned, we're here to sensitize you on health pathologies and how you can better tackle these situations. Today, we'll be looking at something very delicate. We'll be talking about stroke, and we'll also tell you how we can recover from stroke. It could be something very tedious for many, but then we have rehabilitation programs which is known to have helped a lot of people suffering from this condition. With me here, I have a guest, it's a special guest, and she's known as Cynthia Finjap. She's a physiotherapist and a kinesiotherapist. We'll be discussing about all this in the course of this program. Also with me here is Ese Lucy Liengu, my co-host. Hello, Lucy.
Hello, Immaculate Fogui. Hello, ladies and gentlemen. We are glad to have you all.
As I earlier introduced my guest, she's known as Cynthia Finjap. She is a physiotherapist. Hello, Lodak. It is a pleasure to have you on the program.
Hello, ma'am. The pleasure is all mine.
So, Cynthia, we hear about people talking about stroke, but a lot of people have very little information of what it's all about. Can you please enlighten us about this particular disease?
Okay, stroke is a life-threatening condition due to insufficient supply of blood to the brain, and as a result you could have death of brain tissues because there is insufficient supply of oxygen which is being carried by blood to this part of the body.
Now, what are some immediate causes of this particular condition?
Immediate causes of a stroke, you have lifestyle, which has to do with obesity, overweight. You could equally have high cholesterol, inactivity. Now we live in a world where everyone is highly sedimentary. There is lack of exercise, little or no movement. So these are some of the primary causes of stroke. You have age-related as well. You have family history, and you could equally have trauma or injury and some nervous conditions or infections.
Okay, what are the complications of stroke, which we'll be talking about as the different kinds of complication or paralysis?
Okay, what's paralysis to begin with? It's the inability for muscle movements. As such, you can't move a certain part of the body. We have 4 different kinds of paralysis. You have monoplegia, which is the inability to move maybe just one limb or a hand or a foot. Then we have paraplegia, which is paralysis from the waist down to the limbs. We have quadriplegia, which is paralysis from the neck all the way down to the limbs. Then we have hemiplegia, which is the most common in our society, paralysis of one side of the body. So face, arm, down to the limb.
So who is at risk of suffering with a stroke? The age range, who is at risk?
Like I earlier said, stroke could be as a result of inability for blood to circulate properly to the brain. And age-wise, we have more the elderly. You could equally get paralysis from injury, like I said, maybe an accident or trauma, or from a nervous infection or a nervous condition and injury to the spinal cord.
Now, within the context of Cameroon, which of this type of stroke is very common?
Hemiplegia, paralysis, one part of the body.
You are a physiotherapist, and we know sometimes recovery when it comes to stroke can be very complicated. Tell us, how can physical therapy help people who are suffering with this type of condition?
Okay, the physical therapist comes in for re-education or rehabilitation, helping the patient get back to day-to-day life with exercises, stimulation of muscles due to muscle atrophy, stimulation of the nerves which were dormant at some point, and hydrotherapy. You could have aquabiking, acupuncture, and education to the caregivers, exercises which could be done at home to help the patient get back on track. Now, treatment would vary from patient to patient, depending on the cause of stroke and the durability of stroke. The earlier you resume treatment after a stroke, the better. Like it's always said, prevention is better than cure.
Of course. For those who like to participate on today's edition of the program, here are the numbers: 670 5470 49. I repeat, 670 54 70 49 or 656 622222. I repeat, 656 622222.
And now, when we are talking about the different types of the therapies needed, which one goes for maybe for the age, for those who are young? Let's get a difference.
Well, treatment protocol would be tailored to meet each patient at its best. You can't have a protocol which serves for everyone. It depends on the condition at hand. What caused this condition? How long this condition has been? Then the age. And you would have to go easier on the older or the elderly patients and easier on the children as compared to the middle age patients.
Okay. And now, how long does it take for one to recover after you have suffered from stroke? Now, using the therapy, how long does it take for one to recover?
I would still repeat, I can't tell you exactly how long it would take for each patient to recover. You have to look at the cause of paralysis. You have to look at how long this patient has been paralyzed. It's no magic that a patient, for instance, who was paralyzed probably for 2 weeks and resumes treatment maybe 1 week after would get results earlier as compared to someone who has been down maybe for a couple of years.
And can we recover fully with the therapy, like completely?
Definitely, you can. Still, I would tell you the cause of the stroke and how long you've been down.
Let's look at this particular therapy. Who can carry out this? Can anybody? Can I say my sister? I can go about doing it, or I need to go and see a trained professional?
Definitely, you need to see a trained professional. And the professional would equally give education to caregivers. So you would educate the caregivers because at this point in time, the patient is handicapped and can barely help themselves. So whosoever is a caregiver needs to be schooled, needs to be educated on how to go about handling these patients, because you could aggravate the condition by just maybe lifting the patient. You could aggravate the condition by having rigorous exercises. We have a lot of patients who have got ligament torn, tears rather, because maybe the procedure of treatment was too rigorous. You know, at the time the patient doesn't feel anything, so you might cause problems thinking you're helping the patient.
For those of you who are suffering with this particular condition known as stroke, or if you know someone who is suffering this condition, I think now is the time to call and ask your questions as far as this condition is concerned. And I repeat the numbers once more: 670 54 70 49, 670 54 70 49, or 656 622222, 656 622222. You have now talked about the recovery period, which is it's not fixed. Now, if I am the one taking care of a stroke patient, how can I tell he or she is recovering?
Okay. You can tell by movement of muscles. Maybe at the time the patient was down, depending on the kind of stroke, the patient, let's use a hemiplegia, which is the most common paralysis. You would find the face twitching and mouth tilted to one side, or you would find the arm completely down or the leg. At some point in time, after a couple of sessions, you might find movements. You might get the patient tell you, I feel this, I feel that. So there will be sensations which would gradually come up, and movements.
Now, does consistency matter in when it concerns physiotherapy? Like, if you are going or you're seeing a physiotherapist, you need how long do you need to, let's say for a week, do you need to go regularly so that maybe like to say you are going to recover quickly? Like the regularity, does it really match with the way you are going to be healed?
Most definitely. Consistency is key in physiotherapy and rehabilitation. Like in every other aspect of life, consistency is key. So I would go back to tell you, depending on the cause and durability of the stroke, consistency would be key, given that, for instance, if a patient has been down for 1 month or 2 months or so, for the first sessions, you have to see the patient every day. So you really have to awaken the nerves which have been dormant and to stimulate the muscles, because at this point in time, the muscles have become flaccid and weak due to inactivity. So you have to stimulate them, you have to boost them up, you have to do a couple of stretches and exercises to reinforce the muscles, a couple of exercises just to increase elasticity.
Looking at the lifestyle changes for someone who is who is having this situation of stroke and is on rehab, what are some lifestyle changes to adapt during such a period?
Okay, lifestyle changes. You have to watch nutrition. For instance, if the patient was obese or overweight, nutrition has to come into play. If it was a patient who wasn't physically active, you need to get active. You have to watch cholesterol. You have to do a regular or annual checkup, just so in case there is something which is not working out.
We'll come back to the lifestyle changes. We have a call on the line. Hello?
Hello?
Yes, sir. Good afternoon.
Good afternoon, ma'am.
Your question, where you're calling from, your name, and where you're calling from, and your question.
My question is, how can we manage spasticity on a patient with a decorticate posturing with heart meningitis?
We can't get you clearly, sir. Can you repeat the question again once more, please?
How can spasticity be managed on a patient with heart meningitis with a decorticate posturing?
Did you get the question? Lucy, did you get the question?
I
didn't get the question clearly.
It's not really clear.
It's not really clear, sir. Okay, thank you so much. I didn't get what he meant. So, for those, it's still time for you to call and ask your questions. The numbers are already on the screen. And for those on radio, yeah, the number 670-5470-49 or 656-622222. When calling, try to move away from your receiver so your line can be clear. So we're talking about lifestyle changes, doctor.
Okay, lifestyle changes have a lot to help you keep track and stay off a recurring stroke, because once you've had a stroke, you're predisposed to it. So you have to get active, you have to do regular annual checkups. In case of any infection or any condition, it could be easily recognized and handled immediately to avoid any further complications. Those who are excessively into alcohol intake have to drop. Smoking has to be moderated, and eat healthy and stay healthy.
When you talk about eating healthy, can you give us a composition of food that a stroke patient is supposed to live on? What are some of the things they need to avoid? Like when we talk about food and drinks, apart from alcohol, let's look at food.
Salt intake and the rest.
Salt intake has to be moderate. You should always try to strike a balance.
Okay. We have another call on the line. Hello?
Hello.
Yes, sir. Good afternoon.
Good afternoon.
Your name, where you're calling from, and your question.
Yeah, I'm Godfrey Dennis.
Okay.
I'm calling from my 16 in Boya.
Great. Can go ahead with your question.
Yes. I don't know. I want to ask whether frequent muscle cramp can lead to stroke.
Okay, we'll be
Okay,
answering
thank
that soon. Thank you so much for participating. You got a question?
Yes, I got the
Okay.
question. Frequent muscle cramps wouldn't lead to stroke. Like I earlier explained, stroke is the insufficient supply of blood to the brain, which would lead to brain death of tissues in the brain due to insufficiency of oxygen supply to that area, because blood carries oxygen around the body. Now, you could have it either as a result of a rupture of the artery or a blockage of the artery. So cramps will not be a predisposing factor to stroke.
To stroke. And now I want us to concentrate more on the dieting we were talking about. We didn't complete that. What diet should a stroke patient or someone who is going in for therapy should consider?
Let's take it within the context of Cameroon where we are,
Yeah.
of course.
Okay. Vegetables, more, less carbohydrates, more fruits. But more fruits, you have to be aware of your blood sugar levels, because some fruits are naturally very sweet. Less cholesterol, so you have to control oil intake, quality of oil intake, and fatty foods.
Is stroke curable?
Yes.
Completely.
All the types of strokes, like, are they curable?
Now you have to look at the longevity, how long that patient has been down without re-education. Like I said, the earlier the better. And what stroke? Yeah, if it's hemiplegia, you could, because just one side of the body is affected. The patient may not get 100% of what they were before the stroke, but at least 99%. Given the longevity, how long the stroke has been there.
Okay, the last question. When we look at stroke, we know there are two types. That maybe there are some that affects the left side and the right side. Which is more dangerous?
We have a call on the line. We'll come back to that. Hello? Hello? Hello, can you get me, sir? Okay, we just lost that caller, okay? We'll be answering that question then.
Okay. You talked of
The left, like the stroke that affects the left side of the body or the right side, because when we look at some patients, we have patients who are being affected by the left hand or by the right hand, and some believe that when strokes affect your right hand, it is more dangerous. Is it true?
stroke which affects one side of body, be it left or right, that's hemiplegia, and which is much more common in our society.
Okay.
For you to recover from stroke, you need to start treatment as soon as possible. It's like, I will use the example of a baby who is born and has to crawl, then hold stuff to stand up, then walk and all of that. If you have to constantly carry the baby will stay down for quite some time. So once you're hit by a stroke, immediately after you've been to the doctors and you've seen the neurologist and all of that, get immediately to your physiotherapist.
Okay.
Thank you so much for being part of the program today.
The pleasure is all mine. Thank you, ma'am, for going.
Big thanks to you, Lucy, for being part of the program.
Always a pleasure.
And we had our formidable guest, Cynthia Finjap, a physiotherapist and kinesiotherapist. Thank you, ladies and gentlemen, for your keen attention. Stay in the company of more interesting programs. And for technical assistance, we got it from Bertrand Bonzini and Jonathan Babiola. That's it for today. Have a wonderful day.
Vous écoutez Radio Equinoxe, la chaîne du peuple. La chaîne du peuple.